Good morning. Today we are going to see suturing. So, suturing is a most important thing in surgery. So, let's go to the topic. Wait a second. Yeah. Okay. Sorry for the inconvenience. We'll go with the topic. So, coming to the introduction. So, what is suturing? So, suture is a stitch or series of stitches that is made to secure the opposition of the edges of a surgical or traumatic wound. So, whenever a trauma occurs, whether it be RTA or surgical trauma, anything. So, anything. So, we have to close the skin or opposition of the edges, any edges in the human body. So, we use a material to oppose it. So, that is called suture material. So, the procedure is called suturing. So, the materials, as I said earlier, the materials is an artificial fibers that is used to keep the wound together until they hold themselves. So, it can be either synthesized, which is synthesized and woven into a stronger scar. So these are the goals of suturing. Why we have to do suturing? So first thing is wound edge opposition. So as I told, wound edge opposition is very important in suturing. The wound should be properly opposed. The edges of the wound should not avert or invert. So that's why we can get a clean scar. And second one is provide adequate tension. So uh, the tension between the two skin edges should be adequate so that there will not be any gapping in the wound. So that's the main thing. Third thing is maintain hemostasis. Hemostasis means in surgery, hemostasis means we are referring to bleeding. So if anything is bleeding out in a trauma or in a surgical trauma, that is surgical trauma in the sense I am talking about elective surgeries or emergency surgeries, or in trauma, that is apart from the surgical trauma, any other trauma happening in the outside the hospital to a patient. So to achieve hemostasis, this suturing will help out. And this will, fourth thing is the goal will be aid in wound healing. That is, this suturing will help the wound to heal faster and to avoid infection. So, fifth one is to avoid infection. So, say if a wound is not sutured properly, or if the wound is not, it is left open for a long time, the microorganisms will enter into the wound and it will cause the infection for the wound. So, there will be pus discharge and the patient will be sick. So, to avoid that, we use suture material to make the wound closed. And fifth one is, sorry, the sixth one is to provide a clean scar by approximating the edges. This is very important. That's why we are doing a suturing. So these are the goals, 6 goals that we should follow while we are doing suturing. So coming to the characteristics of the suture material. So you know about what are the what is suturing and what are the goals of suturing. Then we are moving on to characteristics of the suture materials. So first one is the physical structure. So physical structure means how physically mean how the suture materials are made of. So physical structure refer to monofilament. This suture material monofilament, this suture material is smooth and tend to slide through the tissues easily. So whichever material is smooth, that is monofilament, it will glide through the tissues easily. And this monofilament material are difficult to knot. This for the example, there will be ethylene. Ethylene is a monofilament material, usually we'll use to oppose the skin closure we will use, and it is a non-absorbable actually. So these monofilament suture materials are very difficult to knot, and this monofilament can be damaged by gripping with the needle holder or forceps. So this can lead to the fracture of the fracture, in the sense when the suture material can be easily broke, that is, it can be damaged. So this is the physical structure about the monofilament. And coming to multifilament, the thing is it is easy to knot, not easy to knot, not like monofilament, which is where it is difficult to knot, and it will have a greater surface area than monofilament. So monofilament is only one filament that will easily glide through the tissue, but in this multifilament will have greater surface area than monofilament, have a capillary actions where bacteria may lodge and be responsible for the persistent infection. So this is the only drawback of multifilament. That is why we will not use these multifilament materials to oppose the skin. So it is used in the subcutaneous tissue and bowel suturing and anywhere inside the cavity, not in the skin. So this material can be coated with silicone in order to make it smooth. So this is the physical characteristics of the suture material that is coming. I will repeat again. So that is monofilament and multifilament. Monofilament is very difficult to knot. Multifilament will be easy to for knot. The only disadvantage of multifilament is infection. So bacteria can lodge so that it will go through infection. So coming to next, the tensile strength. So it can be expressed as the force to break when it pulling at the two ends apart. It depends upon constituent of the suture materials and thickness of the suture and tissues where the tissues we are using. So tensile strength is very important. Tensile strength of monofilament is higher comparatively the tensile strength of multifilament. So and then absorbability. So suture may be materials may be absorbable or non-absorbable. So absorbable suture materials are one example, very good example day to day we are using is Vicryl. So Vicryl is a absorbable suture material. Usually we will not use this it is a multifilament suture material. We will not use in the skin. We will use usually in the subcutaneous tissue. Then this property mean the absorbability taken into consideration when choosing suture material. All these four properties for specific wound closures. Oral mucosa and deeper structure need to be used absorbable suture material, that is Vicryl, but vascular anastomosis needed non-absorbable suture material, because if we are using absorbable suture material, once the if at specific time limits the time limits ends means this suture material get absorbed and there will be a bleeding. So in that situation we have to do, mostly for vascular surgeries we will do only non-absorbable suture materials and biological behavior. It depends upon the constituent of the raw materials. So these are the characteristics of suture material, that is physical structure, and we'll go for a tensile strength, absorbability and biological behavior. These are the things of characteristics. So coming to the armamentarium of the suturing. Armamentarium means what are the things, what are the basic instruments we need to do suturing. That is three basic instruments we need. That is, one is needle holder, a suture needle and a suture material. We will see separately how it works. So coming to the needle holder. Needle holder, it is a instrument, long instrument having specific parts. That is tips or jaws, working tip or jaws, hinge joint, shank, body, catch mechanism or ratchet, grip area. So how to hold this? So the needle holder is held with thumb and the ring finger through the rings. There will be two rings. It's like a scissor. There will be two rings. One ring, in one ring you should place your thumb, and another ring you should place your ring finger. So with the index finger along the length of the holder to provide stability and control. So this is how you should hold a needle holder. So you can see here. So this is the jaws, okay, our working area. This is the hinge joint, and this is the shanks. So in the jaw you can see serrated horizontal serrations. So for horizontal serrations, why? To grip the suturing needle. And this is called ratchet. Will be a locking mechanism. First, there will be grades of locking mechanism: 1, 2, 3. The first thing is to just to hold it. Okay, so this is the two rings. One ring you should place your thumb, and another in this ring, second ring, you should place your ring finger. So these are the parts, and this is the thing how to hold the suture, sorry, uh, needle holder. Coming to suture needle. So it is either made up of stainless steel or carbon steel. So mostly we are using stainless steel as a suture needle. The parts, the parts of a suture needle, that is, there will be tip or point, body or shaft, eye, that is swagged in, and the shape of the needle will be this is called a suture. These are the parts of the suture needle, that is tip, body, eye or swagged in. The shape of the needle, that is uh, classification of the needle according to shape, that is straight or curved needle or straight needle. Usually straight needle we are not using nowadays because of injury to persons who are using straight needles. Only we are using curved needles as of now. And according to eye, so eye, it's the divided into eye needle or traumatic, eyeless needle or atraumatic needle. So these are the classification according to the needle. And classification of needle according to cutting edges, the edge of the needle. Here, this round body or cutting body. In the cutting body, there are two types, that is conventional and reverse cutting. So these are the main things according to the cutting edges and according to its tip, whether the tip of the needle is triangular, round or blunt. So suture needle is very important because for specific tissue the specific suture needle is very important. If you are going to suture a tougher structure like, what to say, rectus sheath in the abdomen, you need a cutting body or a reverse cutting. So it is used, and according to its strip, this triangular, round or blunt. So this is the thing when it comes to suture needle. And coming to suture materials, so what is the ideal property of a suture material? So as I told you earlier, there are three things very important for suturing. The one is needle holder, suture needle and suture materials. So what are the ideal properties? First thing is it should be easy to handle. There will not be any mess while handling, and we have to be make sure that what are the predictable behavior in the tissue and predictable tensile strength. And the main thing is it should be sterile. If it is unsterile, you may lodge the infection into the patient by using the unsterile material. And what is the secure knotting ability, and the whatever suture material you are using is anything, it is a foreign body to a tissue. So you should judge accordingly what is the minimal tissue reaction. So non-allergic or non-carcinogenic or non-shrinkage. So these are the things you will look for when you are taking a ideal this is the ideal property of a suture material. So Coming to classification, there are n number of classification. This is very too easy to follow. That is classifications of suture material according to source. Source is where it is actually prepared from. One, it is natural or synthetic and metallic. According to structure, as I told you earlier, that is monofilament or multifilament. According to its fate. Fate means what if you are using a suture material, either you are going to remove the suture material or you are just leaving like that, so that the tissue as a body will degrade the suture material. And according to coating, whether, as I told you, the absorbable suture material like Vicryl, it can be coated with silicone, okay, or uncoated. So these are the classifications. So coming to natural, mean what are the accordingly, what are the absorbable and non-absorbable, synthetic, non-absorbable. There are selected examples for this. We will briefly go into that. So what are natural absorbable? That is catgut, chromic catgut, collagen, fasciolata, that is extracted from human body tensor fasciolata, and beef tendon. From the beef tendon also they are taking out the natural absorbable suture material. Catgut means it's usually taken from the gut of the cat. Usually will take submucosal layer and they will process it, because submucosal layer of a gut, not only the cat, in humans also, submucosal layer of the gut is a very strongest layer. So that's why they will take the submucosal layer of the gut and they will synthesize into the natural absorbable suture material. Coming to non-absorbable suture material, that is silk, that is taken from silk, worm gut, linen, cotton, and ramie. Then synthetic absorbable, the polyglycolic acid, that is polyglycolic acid, polygalactic acid, and polygalactane, that is Vicryl. Usually, we'll talk. Will usually the trade name is Vicryl, and polydioxanone (PDS). So these are the synthetic absorbable material. In the synthetic non-absorbable is nylon, that is commonly called, the biochemically called polyamide, and proline, that is trade name, that is polypropylene, that is a chemical name, and polyesters, polyethylene. So these are the synthetic non-absorbable. Then coming to metallic. So metallic is stainless steel, that is then tantalum, silver, gold, aluminum. So from gold also they are taking out suture material. So these are the some of the examples you need to know when somebody is asking about what are the natural absorbable, what are the non-absorbable, and synthetic absorbable, and synthetic non, what are the metallic things. So these are the classification of suture materials according to its fate, source, structure, and coating, and uh, according to absorbable thing and non-absorbable, synthetic absorbable. So these are the examples of suture material. Then coming to monofilament absorbable. Monofilament absorbable is catgut, chromic catgut. That is chromium is coated with the catgut, that is called chromic catgut, Vicryl, and PDS. Non-absorbable is polypropylene, polyester, nylon, polyvinylidene fluoride, and multifilament absorbable is Vicryl, polyglycolic acid, and silk, cotton, and linen. So these are some of the examples you need to know. So so as far as we have done with monofilament and multifilament and suturing needles and suture material. So now we are comparing both monofilament and multifilament. What are the differences? So as I said earlier, in monofilament, it has no any capillary action and there is less infection rate, and it is very easily glide through the tissue, and it is having higher tensile strength. So, but it is very easy. It requires more throws. But as in multifilament, it has a capillary action, so increase the infection rate. If because capillaries can invade through the suture materials, so that multifilament means more than one filament is there. So bacteria can lodge into that multi-filament suture material, and it will produce infection, and there is less smooth passage and less tensile strength, and it has better knot security compared to monofilament. So these are the examples of monofilament and the multi-filament suture materials. So what is comparing absorbable and non-absorbable? So how the absorbable suture materials getting degraded? So it is degraded by enzyme that produced in our body and by hydrolysis or phagocytosis, and used to hold the edges in approximation temporarily until the wound is healed. So absorbable is temporary only. So non-absorbable is encapsulated or walled off by the fibrosis and used to suture at sites where tensile strength need to be maintained. As I said, where the tensile strength is to be maintained, mainly in the blood vessels. So we are using non-absorbable, and rectus sheath in the abdomen, and in the lateral part of the thigh where tensor fascia later wherever we used to have a higher rate of tension needed. So we will use non-absorbable suture materials. So so we have done with needle holder, suture needle, suture materials, and its characteristics and properties, and what are the suture materials, whether it's absorbable, non-absorbable, everything we have done. So now coming to how we will select the suture materials. So these are the 5 points we have to take into consideration. So first thing is we have to assess the wound, that is the condition of the wound, whether the wound is uh, infected or not, or the wound is whether the wound can be approximated or not, and whether the wound is very deep or only the skin is injured. So first thing is the condition of the wound. Then tissues to be repaired. So whether, as I told, whether subcutaneous tissue is injured, or only skin is injured, or a very deep blood vessel is injured, or any solid organ injury is there, open fracture is there. So tissues to be repaired is very important. Then tensile strength of the suture material should be taken into consideration, and not holding characteristics and reaction of surrounding tissue. These are the 5 things we have to taken into consideration before selecting a suture material. Commonly used suture materials, that is polypropylene, proline. It is a synthetic non-absorbable monofilament suture material. It is made up of polymer or propylene. So it is usually used in general general surgical procedures like hernia, and in plastic surgeries also, and cardiovascular surgeries, and for screen closure. So these are the areas we are using suture materials. Advantages: it won't lose its tensile strength over the time, and it has a good knot security, and it will produce very little tissue reaction, and it has high plasticity. The only disadvantage is it can be stretched when it is pulled and loosens when edema subsides. So proline, this is the important. It's a non-absorbable suture material. The advantage is it won't lose its tensile strength over time. So that's why we are using it most of the vascular procedures. So the disadvantage is stretch. So it is a monofilament. When you are pulling out, the lead to fracture of the suture material, as I told earlier, and it can be loosened when edema subsides. Coming to silk, it is a natural non-absorbable multifilament suture material. So taken from the silkworm larva. So it is used in ophthalmic surgeries, general surgery procedures, plastic surgery procedures. The advantage is it's very easy to handle, and there is a good knot security, and it's very cost effective. And the only disadvantage is very reactive because it is taken from the natural source, that will maybe, if it is not properly synthesized, properly made, it is very very reactive to the patient, and as it is a multifilament, it may it may cause infection. Coming to Vicryl, so it is a synthetic absorbable suture material that is multifilament. Most of the time it is multifilament. It is coated or uncoated, is available in purple color and it is undyed. So where we are using this, usually we will use this in intraoral suturing, gut anastomosis, and vascular ligature, and in ophthalmic surgery, and superficial soft tissue approximation of the soft tissue approximation of the skin and mucosa. So these are the areas usually we will use the Vicryl. So main advantage is there will be minimal tissue reactivity, and it can be used in infected tissues also, stronger than the gut, and retains its strength by 3 weeks. That is the tensile strength. And the disadvantage is it can, in a case of prolonged approximation, cannot be used, and there will be delayed absorption and increased inflammation. So these are the advantages of Vicryl and disadvantages of Vicryl. So biological response to the suture material. The early response is generalized acute aseptic inflammation of the wound. Primarily polymorphonuclear nucleosides will come and aggregate together in the site of injury where we are suturing. After few days, the mononuclear cells, fibroblasts, histiocytes become predominant, and there will be capillary formation occurs at the end of this initial phase. So what happens to the suture material? Natural absorbable, that will be degraded by proteolytic degradation, and there will be intense tissue response. Synthetic absorbable by hydrolysis, less intense response, and non-absorbable is encapsulation, acellular response. So this thing is very important because you should know how the suture material are getting absorbable suture material are getting degraded. That is natural absorbable by proteolytic degradation, synthetic absorbable by hydrolysis, and non-absorbable usually by encapsulation, that is acellular response. So this is the suture needle. You can see that is a point, that is point I told. There can be triangular, pointed. So three types are the triangular, pointed, and this is the body of the needle. So the needle is curved, okay, and that is called eye of the needle. So these are the points. Tapering point is there, taper cut is there, spatula is there, reverse cutting is there, prime reverse cutting is there, prime conventional cutting is there, and center point of spatula. So in this point means the tip of the suture needle. Very important one is taper cut, sorry, reverse cut, taper point, and the prime reverse cutting. So taper point is usually we'll use in dura, fascia, nerve, subcutaneous tissue, fat and vessels. And reverse cutting is fascia, ligament, nasal cavity, oral mucosa, and tendon sheath. And prime reverse is usually in the eye and for microsurgery and reconstructive procedures. So these are the types of uh, point in a suture needle. Coming to principles of suturing. So how you should suture? Basic steps I will tell you. So the needle should be, so three things as I told you earlier, three things are very important for a suturing. One is needle holder, suture material, and needle holder, suture material, and forceps. So the needle should be grasped at approximately 2/3 from the eye. So from the eye, you should hold with the suture, needle holder, suture needle at 2/3 from the eye. The needle should be pierced the tissue perpendicular to the surface. So it should be 90°. Okay, perpendicular means usually 90°. So then it should not be 45 or 30 or It should not be at 20 degree. It should be at 90 degree. The needle should be placed equidistant, that is 2 to 3 mm from the incision line. So once when there will be two edges now while you are doing suturing. So you should take equidistantly, not like here 5 mm, there 2 mm. Like that 2 mm, here 1 mm, not like that. The equidistance you should measure accordingly. So, okay, the needle should be placed equidistant 2 to 3 mm from the incision. The depth of penetration should be equal on both sides of the incision. That is also very important. Then only we'll get a clean approximation. The needle always passes from the movable tissue to the fixed tissue. And thinner the tissue to the thicker the tissue. That is also important. Deeper the tissue to the superficial tissue. So these are the basic principles. Okay, before suturing you should take into consideration. The tissue never be closed under tension. Don't close under tension, otherwise the wound will not heal, edema will come, and your suture material will loosen. Each sutures must be placed 3 to 4 mm apart from the incision line. So why we are giving this 3 to 4 mm? So that if anything is collecting inside the wound, it will come out. Whether the wound is infected, the pus will come out, or there will maybe a seroma collection, the seroma will come out. So what happens if a seroma is getting collected secondarily? The bacteria will go there, sit there, the seroma will turn into pus. So to let out all the seroma or the pus, you should make the suture equally distant, that is 3 to 4 mm. So what are the basic suturing techniques? That is interrupted suture, continuous suture, mattress, figure of 8 suture, subcuticular suture. So these are the basic sutures you should know at your level. So I will teach you how to do a interrupted suture now. So interrupted sutures or closure of wound after single tooth extraction, a third molar biopsy, dental implant, and advantages is it is very simple, performed in emergency situations, and it is easy to remove. So disadvantages fail to bring all the surface in contact and less supportive for healing. It is very easy to do, and it should be performed in most of the time performed in urgent situations. Okay, so we should know about how it is doing that. So cleaning and debridement of the wound is very important, and we should use appropriate suture material. Wound margins are accurately opposed. Suture needle is held with the needle holder position at least one third, as I told you earlier. A bite of the skin taken at a landmark site. The suture needle is advanced into the depth of the wound. See the depth of the wound. You should go deeper as much as you can. Okay, if the wound is very deep, and then out through the wound opening. You should come out after piercing from the one edge, going deep, coming out of the wound. The needle is inserted via of the depth of the wound and rotated up through the opposite skin margin. So for the opposition of the wound. So like this, we should come out. Okay. So see in this diagram, you can see approximately 0.5 centimeter spacing is there. Not the knot should be on the same side. Okay, and in this picture you can see the needle is going into depth of the wound and they are coming out. So three things. First, usually we will put three knots. So first knot, second knot, and third knot. So coming to this thing, okay, we have done a suturing. How many in days interval we will remove the sutures? That is also very important. Okay, so first thing is we are putting, I mean you are placing, doing a suturing in a scalp. You can remove fifth or seventh day, because scalp has a good blood supply. Like face is also got a good blood supply. Yes, why here is a 10 to 14 days? Because in here most of the things are end arteries. So you should wait till 10 to 14 days. chest and abdomen, because of the tough structures are there, you should wait for 8 to 10 days. Back and extremities, tough structures, you have to wait for 12 to 14 days. Hand, 10 to 14 days, because the skin will be in the hand is very thin. So you should, otherwise if you are removing early means it will predispose to infection or necrosis. So you should wait for 10 to 14 days. Foot and sole, tough structures, so 10 to 14 days. Genitals, 8 to 10 days is minimum. So this is the time period where you will remove the suture material accordingly. So I discussed with only the interrupted suture. You go on study about continuous, how continuous suture is made, mattress and figure of eight. Figure of eight is very easy to learn. Mattress is little bit difficult, but you will read, you will come to understand. So these are the techniques, and this is the time limit where when will you remove the suture. Okay. Hope you have understood very well. So thank you. The session ends here. We'll meet in the next session. Thank you.